All right, let's dive in. Today, we're talking about hemophilia, a name we all kind of know, right? We think of royal families, the risk of bleeding, but the real story? It's way more interesting and complex than you might think. So, right off the bat, let's tackle the big question for this whole explainer. Is hemophilia always something you're born with? And trust me, the answer isn't as straightforward as you think. It actually tells us a ton about the amazing and sometimes fragile way our bodies handle blood clotting.
Okay, so before we get into the really surprising stuff, we've got to lay the groundwork. Let's start with the classic inherited form of hemophilia that everyone thinks of.
So, what is it really? At its heart, inherited hemophilia all comes down to a shortage of these crucial little proteins called clotting factors. It's passed down in a way that's linked to the X chromosome, and that's exactly why you hear about it affecting guys so much more often. And get this, it's not even just one single thing. Hemophilia A means you're missing clotting factor 8. Hemophilia B means you're short on factor 9. So you've got two different missing pieces, creating two totally distinct versions of the same underlying problem.
Okay, and here's our first big curveball. You'd think, right, that it's always in the family tree. And yeah, about 2/3 of the time it is, but a whopping 1/3 of cases are what they call sporadic. That means a brand new genetic mutation happens, and a child becomes the very first person in their family to have hemophilia. So yeah, even the version we call inherited can literally pop up out of nowhere.
Okay, so we've got the genetic side down, but what about when someone is perfectly fine their whole life and then, bam, they start having serious bleeding problems? This is where the story gets much, much bigger than just genetics. So that leads to the obvious question, right? Can you just get hemophilia as an adult? Well, the answer is kind of no, but it's more complicated than that.
This is where we have to bring in a whole new category of conditions, acquired coagulation disorders. And just like the name says, these are things you acquire during your life. They're not genetic like hemophilia, but boy, can they look and feel just as serious.
So how does that even happen? Well, our body's clotting system is like this super delicate chain reaction. If you mess with one link, the whole thing can fall apart. We're going to look at four major ways this can go wrong. So what are they? We're talking about a vitamin K deficiency, liver disease, an autoimmune issue called ITP, and a really complex condition known as DIC. Let's just quickly run through them. Okay, first, vitamin K. Now, this isn't just any old vitamin. Think of it as a key ingredient, a non-negotiable part of the recipe for a whole bunch of clotting factors. If you're running low, whether it's from your diet, a problem absorbing it, or even some medications, your body just can't manufacture the stuff it needs to plug a leak. Then we have something called ITP, or immune thrombocytopenia. Here, the clotting factors might be fine. The problem is the platelets. Your own immune system basically goes rogue. It gets confused and starts attacking and destroying your platelets, which are like the first responders to an injury. And then there's DIC. This one is really wild and incredibly dangerous. What happens is your body starts forming tiny clots everywhere, all at once in all your small blood vessels. It's like a panic reaction that uses up all your emergency supplies, your platelets, your clotting factors, on false alarms. So when a real cut happens, there's nothing left in the tank to stop the bleeding. And here's the key thing about DIC. It doesn't just happen on its own. It's pretty much always a catastrophic complication of something else really bad that's going on, like severe sepsis or major shock. It's the system just revving itself into the red and then completely burning out. Okay, this brings us to a really, really important point, one that causes a lot of confusion. You might hear the term acquired hemophilia thrown around, but what it actually means isn't what you'd think. It's not a whole new disease. It's actually a complication that can happen to someone who already has the inherited version. So let's be super clear on this. This is something that develops in a person with inherited hemophilia. It is not something a person without hemophilia can just, well, acquire. So what is this complication? It's the development of something called inhibitors. See, when someone with hemophilia gets their treatment, which is basically an infusion of the clotting factor they're missing, their body can sometimes freak out. The immune system sees this helpful protein as a foreign invader, so it creates antibodies to fight it off. And those antibodies, the inhibitors, they just neutralize the treatment, making it useless. And this is not a small problem. For people with severe hemophilia A, as many as 30%, that's almost 1 in 3, will develop these inhibitors. Now, for hemophilia B, the risk is way lower, only about 3%. But for any patient who develops them, it's a huge, huge challenge for their treatment. All right, so let's zoom out and put all these pieces together. On one hand, you have inherited hemophilia, and on the other, you have this whole group of acquired bleeding disorders. And telling them apart isn't just for textbooks. It is absolutely vital for treating patients correctly. So let's just run down the big differences one more time. Inherited hemophilia, that's genetic, you've got it from birth, and the treatment is replacing the missing factor. Acquired disorders, they're a side effect of something else. They show up later in life, and the only way to fix it is to treat the root cause, whether that's a vitamin deficiency, a liver problem, or whatever's triggering the immune system. And really, that's the bottom line here. You just can't lump all bleeding problems into one bucket. It's actually dangerous. You can't fix a vitamin K problem by giving someone factor 8. It just won't work. Getting the diagnosis right is everything. It's the absolute first step to getting the right treatment and managing the condition properly. So that leaves us with something to think about. Even a condition we all think we know, like hemophilia, turns out to be so much more complicated than we thought. And it really makes you wonder, doesn't it? What other medical conditions out there have a much deeper, more complex story hiding just under the surface? Thanks for digging into this with me.